My name is Katie Reynolds, and I'm a student in the Psychiatric Mental Health Nurse Practitioner program at EKU. I am doing research on the negative stigma associated between nurses working in mental health and borderline personality disorder patients. The relationship between mental health professionals and borderline is viewed as negative across the country. This is viewed as a negative population to work with amongst nurses. This is challenging both physically and emotionally for nurses. The nurses are viewed by the borderline personality patients as being unhelpful, hostile, unsympathetic, and socially rejecting. The nurses view the patient population as confrontational, which leads to aggression, and the patients and nurses both feeling hopeless, frustrated, angry, and disappointed with each other. Instead of the nurses blaming and punishing this patient population based on their diagnosis, they should focus on questioning and understanding. The relevance this has to nursing today is that if patients and nurses do not have a therapeutic relationship, then patients can experience ineffective treatment, which can lead to frequent readmissions and infrequent treatment. This can cause burnout and stress for the nurses. The nurse's inner role changes reciprocal between the patient and the nurse. The nurse feels that they need to satisfy the patient, so they meet their needs. The patient is satisfied for a minute and then not satisfied, and then wants another thing completed, and then the nurse completes that, and the patient's not satisfied again, and it just is a continuous cycle. The nurse then cuts off the extra treatment, and then the patient self-harms and isolates. The nurse is left feeling annoyed and powerful. The patient then is demanding help, but then rejects it, and then this is a continual cycle. Evaluated 5 studies. Overall, all the studies done were between 2003 and 2014. They all use questionnaires with mental health population, with nurses or technicians that worked with borderline personality patients, and all of them viewed borderline personality disorder as a difficult population to work with. The workers were less likely to help patients with the diagnosis of borderline. They rated their personal experience of working with these patients negatively. Some believe that borderline personality disorder patients could control their behavior but deliberately sabotage their treatment just to make the nurses feel less empathetic and withdraw their support from them. And then nurses feel that they have negative interactions with this group because they're unable to help and they lack the necessary skills to treat this population. Overall, majority of the research that I viewed in the synthesis process had negative stigma, but the nurses were willing to take part in training to learn more about the diagnosis and the treatment. They all involved qualitative questionnaires and used Likert scales in the ratings. The application of nursing is that the development of therapeutic relationship is essential to having a positive relationship with nurses and borderline personality disorder patients. The key to having a therapeutic relationship is respecting the client, facilitating trust between the client, and engaging the client in his or her own care. Some interventions that could be useful to nursing today is clinical supervision and education on the diagnosis and management of borderlines. Clinical supervision is one-on-one or group treatment where a clinical nurse specialist follows the nurse with the borderline personality and allows the nurse to learn, develop on the practice, and gain insight as they are supporting and guiding them on useful techniques used to control this population. Education in this area should involve staff splitting and power struggles, something that you see with borderline patients, to help them to notice this type of behavior and help them educate the nurses on how to handle it and how to recognize it, reducing their own defensive behaviors, and this could help them overall in the treatment of borderline personality patients.